now we will discuss about the ambiguous genitalia, right? So you already know, if let us suppose this is the testosterone, right? Testosterone, and we have XY individuals and XX individuals. Now what will happen if this testosterone is absent, right? Then in XY individuals, what will happen? We will have female external genitalia, right? We will have female external genitalia. In XX individuals, if the testosterone is absent, it will again lead to female external genitalia, right? Female external genitalia. Because I have already given you a concept, testosterone present है तो male external genitalia होगा. If it is absent, then it will be the female external genitalia, right? Now, the second one. Now, if the testosterone, one condition it could be absent, or the other condition if it is present in normal levels. Okay, if it is present in normal levels, what will happen? There will be male external genitalia, right? In XY individuals, it is the main external genitalia which will be formed, right? Apart from that, in female XX individuals, the testosterone, it is not present to up till that extent that it should be it will lead to the formation of male external genitalia, right? So remember, in XX individuals, what will happen? The testosterone, it is not present in such levels that it will lead to development of, or the male external genitalia will be formed. Male external genitalia will be formed, right? So it is not in that level. So no male external genitalia is formed over here. Apart from that, remember, if it is present in low levels, what will happen? Now, this is something which is common to both of this. This is ambiguous genitalia, right? Now, starting with the ambiguous genitalia, so remember that this includes clitoromegaly. Okay, it includes clitoromegaly. Yes, we have labioscrotal fusion. Okay, we can also see micropenis, very short penis, right? Micropenis, and there could be much more, right? So ambiguous genitalia, when the testosterone is there but it is present at low levels, it will include clitoromegaly, right? Labioscrotal fusion. Along with that, we will get the micropenis. Now, there are two questions that are being asked. The most common cause of ambiguous genitalia in XX individuals. Now, when I say XX individuals, I'm like the females, right? It is the congenital adrenal hyperplasia. It is congenital adrenal hyperplasia, right? Now, another question. The most common cause of ambiguous genitalia in XY individuals, it is androgen insensitivity syndrome. Okay, it is androgen insensitivity syndrome. Now, what is the first step that you have to do when a child is born with ambiguous genitalia? The first step, it is you have to thoroughly do the physical examination, right? Now, remember the two questions again. The first step, how do we decide the sex of the fetus? No, by looking at the external genitalia. Now, if you are not clear whether it is male or female, like what you will do next, by thorough physical examination, if you are not able to know clear that whether it is male or female, then the next the investigation of choice over here will be karyotyping. Okay, it will tell us whether the Y chromosome is there or not, right? So the first step to do when a child is born with ambiguous genitalia, you have to do thorough physical examination. Thorough physical examination. And the investigation of choice over here, it will be karyotyping. It will be karyotyping. Okay, it will tell us whether it is containing an X chromosome or not. Now, before coming to these causes like the androgen insensitivity syndrome or congenital adrenal hyperplasia, let us discuss about hermaphroditism, right? So there are two hermaphrodites, right? We have the true hermaphrodite and we have the pseudo hermaphrodite. So, true hermaphrodites are the one in which these are the individuals with both ovaries and testes, with both ovaries and testes which is present, right? इसी इंडिविजुअल में ओवरीज भी देखने को मिलेंगी और टेस्टिस भी. Now pseudo hermaphrodite are the ones, okay, are the ones we have the female and the male, right? So the female, basically these are called as the pseudo hermaphrodite, right? Now pseudo hermaphrodite over here means the gonads over here will be ovary, right? The gonads will be ovary, but the external genitalia will be of the males, right? The external genitalia will be of the males. So this is pseudo hermaphrodite. If it is seen in a female, the gonads will be ovary, but the external genitalia will look like male. And the most common cause over here, it is congenital adrenal hyperplasia that we already discussed, right? We have just talked. So in males, if we talk about pseudo hermaphrodite, now it means that the gonads will be testis, right? And the external genitalia, it will look like females, okay? It will look like females. And the most common cause over here will be partial androgen insensitivity syndrome. Partial androgen insensitivity syndrome. So that was about the hermaphroditism, the true hermaphrodite and the pseudo hermaphrodite. True hermaphrodite means ovotestis. Both ovary and testis will be present. Pseudo hermaphrodite, in female, the gonads will be ovaries, but the external genitalia looks like male, right? And the most common cause over here, it is the congenital adrenal hyperplasia. Whereas on the other hand, if we talk about the male, the pseudo hermaphrodite means the gonads will be testis, but the external genitalia will look like female, and that is the most common cause over here, that is the partial androgen insensitivity syndrome. Now let us discuss about this one by one. The very first one, that is the true hermaphrodite, the true hermaphroditism. Now you already know the karyotype over here. The karyotype over here will be 46XX, right? It will be 46XX. That is the most common karyotype, or in some cases it can be 46XY also. It can be males also, it can be female, but most of the time it is the female. Okay. Now if you already know that gonads, if we talk about the gonads, so remember both ovaries and testes will be present. Both ovary and testes will be present, right? Both ovaries and testes are present, one on each side or both on each side, right? One on each side or both on each side. So that's why it is called as the ovotestis, right? That's why it is called as the ovotestis, right? Ovotestis. Now see, one side where ovary is present, what will happen? Ovary is present, it means that the Müllerian duct will develop, right? One side, you already know ovary is there. If ovary is there, then what will happen? Müllerian duct will develop. Müllerian duct will develop, right? Müllerian duct develops and it will give rise to female, the female internal genitalia. Develops, right? Whereas on the other hand, right, on one side, let us suppose on one side the testis is present. The testis is present. Now, if testis is present, what will happen? Wolffian duct will develop. The Wolffian duct develops. Okay, the Wolffian duct develops and the male internal genitalia will be developing. Develops, right? So now, since the hormone, okay, testosterone is present. Now, I have already told you the testosterone is present, but it is not present in actual amount. It is present in low quantity, right? It is present in low quantity. It will somehow lead to masculinization. It will lead to masculinization of external genitalia. Right? So these are taken as male child at birth. These are taken as male child at birth. जब ये पैदा होते हैं तो basically they look like male. हम लोग इसको like throughout it is the male child. They are taken as male child at birth. Okay. Now out of these these male child, 3/4 will develop gynecomastia. And remember 1/4 of these male childs, like we are taking this as male childs, but they have both testes and ovaries. तो ऐसे मेल्स में आप लोगों को गायनेकोमेस्टिया देखने को मिलेगी. There will be breast development in males in the later life. Apart from that, 1/4 males will also show menstruation. Okay, menstrual cycle भी देखने को मिलेगी in males में. So that is something very very important. You have to know about the true hermaphroditism, right? Coming on to the next one, that is the congenital adrenal hyperplasia. See, it is the most common cause. I would say it is the most common cause of ambiguous genitalia in female. It is the most common cause of ambiguous genitalia in females. Now, there is an enzyme which is deficient over here, right? there is an enzyme which is deficient. The most common enzyme deficiency which you will see over here, it is 21 alpha hydroxylase. Okay, and the second enzyme deficiency, the most common, it is the 21 alpha hydroxylase. The second enzyme deficiency, it is 11 beta hydroxylase. So these enzymes are basically required for the production of cortisol, corticosterone and aldosterone. Now suppose these enzymes are absent, right? These are not there. These enzymes are deficient. What will happen? You already know adrenal hyperplasia. We're talking about the adrenal hormones, right? So there will be decreased levels, okay? So there will be decreased cortisol, okay? There will be decreased cortisol. There will be decreased corticosterone, right? Corticosterone, and there will be decreased aldosterone. There will be decreased aldosterone. So yes. Now, since there is decreased cortisol, the negative feedback on ACTH, adenocorticotropic hormone, will be lost. So ACTH, adenocorticotropic hormone, will be increased, and yes, the androgens will also be increased over here. The androgens will be increased over here, right? Now, you already know if there is decreased aldosterone. Now, these individuals, now if we talk about the clinical features, these are 46XX individuals, right? In females, it is the most common cause of ambiguous genitalia. Now, if aldosterone is less, now what will happen? They will not be able to absorb sodium, right? Then they will suffer from hyponatremia. Hyponatremia, okay? The child will have the hyponatremia. It means it will have the low BP. Low BP. If there is hyponatremia, there will be on opposite side, it will be like hyperkalemia and metabolic acidosis. Metabolic acidosis, right? Metabolic acidosis. Now, due to decreased cortisol, there is hypoglycemia also, right? If the cortisol is decreased, okay, they will suffer from hypoglycemia also, right? So yeah, the BP is decreased, the baby's BP is decreased due to hyponatremia, cortisol is decreased, there will be hypoglycemia, okay? So yes, whenever female is born, whenever I would say a newborn is born with congenital adrenal hyperplasia, so we have to give them treatment. It is basically hydrocortisone we have to give, right? Hydrocortisone, okay? We have to give NaCl because the levels of NaCl is reduced, okay? We can also give fludrocortisone, right? Apart from that, yeah, reconstruction surgeries are carried out for the genital part, okay? Reconstruction surgeries are carried out for genital part, right? So that was about the congenital adrenal hyperplasia. Remember that whenever newborn, okay, whenever a newborn, it is having ambiguous genitalia, it is born with ambiguous genitalia, okay, what is the first step that you will do? The first step over here, it is you have to carry out a thorough physical examination. Physical examination, okay, physical examination. And yes, the first step, it is the physical examination. Physical examination means if gonads are palpable, then what you will see, 46XY karyotype, right? Karyotype will be seen, okay? If gonads are not palpable, okay, if they are not palpable, you can palpate the testis, but if it is not palpable, then what will be there? It will be 46XX karyotype, right? Female, right? Now, the first step, it is to do this. But if I ask you the best step, okay, the best step, it is to done, okay, karyotyping should be done, right? Okay, karyotyping should be done, which will determine whether the Y chromosome is there or not, right? Now, if 46XY karyotype is suspected over here, if it is suspected, then you will do the investigations. What all investigations? Testosterone levels, right? Dihydroxytestosterone levels, okay? Anti-Müllerian hormone, luteinizing hormone, follicle stimulating hormones, and you will do an ultrasound of the pelvic region, pelvic ultrasound, right? If 46XX karyotype is suspected, now what you will do, it can be probably congenital adrenal hyperplasia. Remember, it is a life-threatening condition. I've already told you that the BP will be low automatically. There will be hypoglycemia. So it will be a life-threatening condition. And you have to send all the investigations, but do not wait for the report to initiate the treatment, right? So over here you have to do a karyotype, right? Karyotype, or you can do fish procedure also, and you will check 17-hydroxyprogesterone levels, okay? And the serum electrolytes. I've already told you the sodium levels will go down, right? The serum electrolytes. So that is how you have to work up with a case of ambiguous genitalia. Yes, that was about how to work up with a case of this ambiguous genitalia. Now let us discuss about the androgen insensitivity syndrome. Androgen insensitivity syndrome. You already know the karyotype. The karyotype, it is 46XY, right? Complete androgen insensitivity syndrome. I'm talking about the complete type. There are two types of androgen insensitivity syndrome. It is complete androgen insensitivity syndrome, okay? The child has, it is resistant, the newborn, it is resistant to the testosterone and dihydroxytestosterone. Complete resistance is there. Whereas we have the other type also, that is the partial androgen insensitivity syndrome. Now, you already know the karyotype over here will be 46XY, okay? The gonads will be testes, but these testes will not be descended. So we have undescended testes. We have undescended testes, right? Now, what is the problem over here? I have already discussed the individuals, right? The individuals, they are insensitive to testosterone and dihydroxytestosterone, right? Now, you already know the Sertoli cells over here. The Sertoli cells will secrete the Müllerian inhibiting substance, right? So the Müllerian duct will regress over here. But on the other hand, the Leydig cells, they will secrete the testosterone, right? But these individuals are resistant to testosterone, right? Testosterone is present, but these individuals are resistant to testosterone, right? They are resistant to testosterone. So what will happen? The Wolffian duct will regress. So over here, the internal genital organs will be none. You will not see any internal genital organs. So if we talk about the external genital organs, now what will happen over here? The external genital organs, you already know, since it is resistant to testosterone and dihydroxytestosterone, so the female genital organs will be seen. Female genital organs will be seen, right? Now what happens at puberty? At puberty, this testosterone which is resistant, testosterone to resistance है, use नहीं हो रहा testosterone, this testosterone will get converted to estrogen. It will get converted into estrogen, right? So if estrogen is there, there will be development of the breast, right? Gynecomastia will be there, but pubic and axillary hair will be absent, right? So remember over here that the pubic and axillary hair will be absent as they are resistant to androgens, as they are resistant to androgens. As they are resistant to androgens, right? LH will be increased due to resistance to testosterone. Even the LH, it is like increased, and FSH will be normal, right? FSH will be normal, right? Because due to inhibin, which is secreted by the Sertoli cells, so yeah, it will be absolutely normal. Now, what is the management? What management you will do for these cases? So let individuals be female, right? Let individuals be female. Okay. So you have to do gonadectomy. You have to remove the gonads, the testes, right? Gonadectomy after breast development. After breast development. Okay. And breast development usually like 16 to 18 years of age. 16 to 18 years of age, right? You can also do estrogen replacement therapy. Estrogen replacement therapy, right? Progesterone, it is not needed as there is no uterus over here, and you can also do vaginoplasty. Vaginoplasty, right? So this is something that you can do in cases of androgen insensitivity syndrome. Thank you.